In 1932, the United States Public Health Service made an offer to 600 black men in rural Alabama: free health care, free meals, burial insurance. What they didn't tell them was that this offer would cost many of them their sanity, their sight, their lives, all in the name of science. This is the story of government betrayal at its most evil. According to the CDC's official documentation and historical records from the National Archives, 600 black sharecroppers from Macon County, Alabama, were recruited in 1932. The government told them they were being treated for bad blood, a local term for various ailments. They received free exams, free meals, burial insurance. They thought they were being helped. They were being hunted. The truth, documented in USPHS records, 399 of these men already had syphilis. They weren't being treated. They were being observed. The government wanted to watch what happens when syphilis goes untreated, how it destroys the body, how it kills. According to the CDC and the National Library of Medicine records, there was never informed consent. The men were never told what they really had. They were never told they were part of a medical experiment. They were simply told to come back for regular checkups. They came. They trusted their government. They were betrayed. In the early 1940s, penicillin was discovered. According to peer-reviewed medical journals and government records, penicillin cured syphilis. It worked at every stage. It was safe. It was available. By 1945, the CDC confirms it became the standard treatment. The government didn't give it to them. Instead, according to documented medical records, public health service officials convinced local doctors in Macon County not to treat the study participants. The men were told they couldn't seek treatment elsewhere. Some tried. They were blocked. The government actively prevented them from getting the cure that could save their lives. For 15 years after penicillin became available, the men went blind. According to medical autopsy reports documented in the National Archives, their organs failed. Their minds deteriorated. Some went insane. All the while, doctors watched. Doctors documented. Doctors took notes for science. The CDC records show that 40 wives were infected with syphilis. 19 children were born with congenital syphilis, infected from birth. The doctors knew. They documented it. They did nothing. The study continued. By 1966, 40 years into this nightmare, one man finally broke. Peter Buxton was a 28-year-old epidemiologist working for the Public Health Service in San Francisco. According to historical records from the American Scholar and PBS, he learned about the study from colleagues. He said later, "I didn't want to believe it. This was the Public Health Service. We didn't do things like that." He was wrong. They did. In November 1966, according to documented letters in the National Library of Medicine collection, Buxton filed an official protest with the CDC. He wrote, "Have any of the men been told the nature of this study? Are untreated syphilitics still being followed for autopsy?" The response came in March 1967. According to PBS and American Scholar records, Buxton was summoned to Atlanta. CDC officials chewed him out for what they called impertinence. His concerns were dismissed. The study was too valuable, they said. The data was too important. Buxton was told to mind his own business. He filed another protest in 1968, again rejected. The study continued. More deaths, more infections, more destruction. In 1972, 6 years after Buxton first tried to stop it, he couldn't stay silent anymore. According to the Associated Press and National Archives documentation, Buxton leaked the study to journalist Gene Heller. On July 25, 1972, the story broke in the Washington Star. The next day, it hit the front page of the New York Times. The headline, "Syphilis victims in U.S. study went untreated for 40 years." America was horrified. Congress called hearings. The study ended immediately. But here's the betrayal within the betrayal. The government only stopped because the media exposed them. They didn't stop because it was wrong. They didn't stop because Buxton pleaded with them in 1966. They only stopped when the American people demanded it. By then, according to CDC records, 128 men were dead from syphilis or its complications. Another 100 died from related causes. The survivors sued. In 1974, they received a $10 million settlement. By the time President Clinton apologized in 1997, 65 years after the study began, most of the men were already gone. This is what happens when power meets vulnerability, when government meets desperation, when science becomes an excuse for cruelty. The Tuskegee syphilis study shattered trust. According to 2016 peer-reviewed research published in medical journals, the disclosure of this experiment in 1972 is directly correlated with decreased medical participation among African Americans, increased mortality, and reduced physician interactions. The damage didn't end in 1972. It echoes today. This happened, not in Nazi Germany, not in a dictatorship, in America, by American doctors, for American science. If this shocks you, if it outrages you, you need to hear more stories like this. Stories of betrayal, stories of resilience, stories of what happens when nobody's watching. Subscribe to Ikamafuna History TV. Follow, share this, tell people. Because if we forget this, if we let this become just another footnote in history, we're allowing it to happen again. These men deserve to be remembered. Their names deserve to matter. Their suffering demands we never look away.